Hi, my name is Emily. I am now going to be showing you the week 6 medical administration of mixing cloudy and regular insulin along with a subcutaneous injection. Let me do my room scan. So I know that this is part of the subcutaneous injection demo, so I'm gonna flip that over, cover it with MAR. There we go. Cool. My notes are back here, closed and everything. My laptop is off, and these are just my meds. Alright, so I'm gonna start first by, so I have an order for insulin, and the key with this is you want to make sure that the cloudy insulin, the MPH, is cloudy. If it wasn't cloudy, and if it had, if there wasn't this like kind of, I think Professor McDragon described it as like mixing salt and sugar together, I would call them. And I want to make sure my clear insulin, my regular insulin, is clear, no contaminations. If there was, I would call pharmacy and ask for them to tube down another one. The most important thing is not contaminating them, because that would create chaos and we don't want that. So I would grab my insulin syringe first and foremost, take it out of the wrapper and everything, and I would start first by, so I know I'm going to start first by rolling my cloudy NPH insulin into my hands. I don't want to shake it because I don't want air bubbles in my medication, so I just roll it, make sure it's all dispersed, take an alcohol wipe, grab the top of it, and then I'm going to go ahead and take my needle, retract 5 units of air, just like that, uncap, go ahead and take my, again, cloudy, inject, blow out the air, and I'm going to put that down, and I'm also going to now retract 10 units of air, boop, 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 take my regular insulin, go ahead and inject, push out that air, flip it, boop, 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 make sure all of it's at the bottom, and I'm going to go look, double check, bam, 10 units of that, beautiful. And I'm going to now go back to my cloudy insulin and inject, and oh, you know what? No, I'm not. I am not going to do that. Actually, no, I am going to do that. Continuing on. Flip it, and then administer another, go back to 15 units. So wait till it goes to the 15. Alright, it's at the 15. With insulin, it's really important to make sure you get the correct dose, because you can cause a patient to become hypoglycemic. So in order to avoid that, I would probably have someone else just double check to make sure it's 50 units. Just because it's better to be safe than sorry. I don't want any adverse effects. And I would do my one hand swoop. And then, ooh, that was bad. Okay. Now that I have my insulin prepared, I did all my medical checks. I did my first 2 medical checks. I would now go into the patient's room. I don't know if I can like bring this closer. It's gonna be my little sick diabetic patient. Hopefully he's not dying, because I want to be a good nurse. And then I'm going to be doing a subcutaneous injection. So I'm going to be using this. I'm going to do my whole medication education, ask if he wants injection, make sure that there's nothing contaminating, make sure that there's nothing that would contradict, no allergies of that sort. Do you want the injection now? Yes, I have the patient's consent. I'm going to go ahead, boop, 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 let them know exposing their abdomen. So I could do a subcutaneous injection in a couple different areas. I could do it under the rib cage or above the hip bone, in the abdomen area. I could do it, ooh, I'm blinking. I could do it, I'm blanking. I'll come back to that. Let me do this first, because I'm more stressed out about this. So I'm going to take this, do 1 inch away from the umbilicus. Bam. I'm going to go right here. I would normally have on gloves, wipe down the area with an alcohol wipe, pinch 2 inches. Just because I'm in the abdomen area, I'm going to pinch 2 inches, which means I'm going to be going in with a 90-degree angle. For subcutaneous injections as well, I'm using I could use 5/8 of an inch if I'm doing a 45-degree angle, but since I'm going in with at a 90-degree angle, I can use 1/2 inch. So I'm going to first start by uncapping, pinching. Alright, just for visual purposes, I'll do it on here. I'm going to go in, I'm pinching 2 inches, so I'm going to go with 90 degrees. So I'm going to pinch, hold it like a dart, go ahead and inject, release, stabilize my needle, inject the plunger slowly, and then go out the same way I came in, and then do the safety. And put that back on him. Alright, clean, clean, clean. So that's how I do the mixing of insulin and doing a subcutaneous injection. Now, I could also do the posterior of the arm as well. So I could do it like back here, because that's where I get my MMR shot. I just gave my mom a shot there the other day. Yep, there's that.